only thing sometimes you can see on the axial cut there, you'll see that there are two two nerves in the canal. I'll just show that later. So let me very quickly now go on to the radiological anatomy. I'll just take about 15 or 20 minutes with that. And I will have to stop sharing this and start to share this right here. Okay, so right. So I have actually using this software was actually introduced to me by Satish few years ago, and I really love it. I love it because you see, you can't possibly look at thousands of static images, and here we can go up and down, and we basically correlated with the sagittal scan and with the axial view. So let me just I've already. The other thing I love about this software is that you can anonymatize the patient. You can erase out the patient's name. Now in Singapore, we are very particular, or let's say the SMC, our governing body, is very particular about not displaying patient's name on social media. So there is a kind of icon here where you can basically hide the patient's name, and that is what I love about this software. So what I'm going to do now is go very quickly, and I've taken the opportunity to I can open the NPR. Basically, we can be looking at all the three axial, coronal, and the sagittal images at the same time. So let me start right here. I'm going to take this crosshairs away, and here now let's look at here. Now let me go. We are going from superior to inferior. And like I told you, the first thing that you'll see will be the mastoid air cells. And this is already the sigmoid sinus. And you haven't seen the arcuate eminence yet, or the superior semicircular canal. But what you see here is a very discernible groove. What is this groove? This is the groove for the superior petrosal sinus. Now let's go more inferiorly here. See, it's very discernible. This is the groove for the superior petrosal sinus. Now we are going and more inferiorly, and you now start to see the superior semicircular canal. Right here, I can go here and that, and you can see the superior semicircular canal. I can bring the crosshairs here, and you can identify it all on the coronal and also on the sagittal images. We can take the crosshairs away, and now we are going. What is going to happen to the superior semicircular canal? We know from our anatomy that is going to have two vertical parts now. This is the anterior, this is the posterior part, and this is going to be the ampullary part, and this is the non-ampullary. So this is the mastoid air cell. Now let us go more inferiorly here. And what is the next structure that I'm looking out for? No, when I'm looking at the CT scan, what I like to do is divide it into four components very quickly, so that you're looking at the petrous apex, and then the aortic capsule, then the middle ear, and then maybe the external ear, and then around the ear, what's going on there. So with nothing happening here, you can see the carotid artery coming into view, but let's go down very inferiorly right here. And what do we see here? There is a canal going through the superior semicircular canal, and that is the arcuate artery that you talk. All these are very important landmarks which you'll always find on the CT scan. It will help you to know where you are. Okay, so this is the ampullary end of the semicircular canal, and this is the non-ampullary end. So let's go a bit more inferiorly. And now what has happened? This is important now. I call it the spoon appearance. Now, when you see this kind of spoon appearance, you will see two things. This is the crus commune, and I can confirm that is the crus commune. You just bring it here, and you can see here, right here. Look at this sagittal cut here. This is the superior semicircular canal, posterior, and the crus commune right here. Okay, and this is the posterior semicircular canal. But another interesting thing is happening here. Is something is opening up here, and that is the internal acoustic meatus. At the same time, we are seeing more mastoid air cells. So let me go a bit more inferior. And what we'll see here now is something is opening up here now. Let's see what's that. And that is the geniculate ganglion. You can see it right here on all this. Okay, this is geniculate ganglion, geniculate ganglion, geniculate ganglion. Okay, and when we go slightly more inferiorly, it will open up, and now you see a beautiful view of the labyrinth part of the facial nerve, genital ganglion. You don't need, and you see a part of the superior vestibular nerve and the vestibule. So what has happened here? The lateral semicervical canal has met up with the ampullary end of the superior semicervical and is forming the vestibule. But you still see the lateral, posterior semicervical canal. Another interesting thing that is happening here, you start to see a little shadow here. Now, what is that going to be? What did I tell you? Anything that runs parallel with the posterior semicervical canal is going to be the vestibular aqueduct. And we start to see here the head of the malleus and the incus. So let me go a little more inferior. And here, exactly where I told you the cochlea is going to be, we saw it on the pictures that I showed you earlier. This is the apical turn of the cochlea, and you see the J shape. Now, very important with this software is that you can scroll it up and down. Now, what I'd like to see here, this vestibular aqueduct, or then has a J-shaped configuration. Look at that. So here, and then it goes down, J-shaped configuration. All right. And that is very good. The maximum diameter of this is roughly about 2 millimeters or so, but it can narrow down to about 1 millimeter. So let me just go on now more inferiorly. And here, when you see an ice cream cone configuration on the X scan, that means you are still in the epitympanum. And this is here is the epitympanum, this is the mastroid cell, and this is the adiatus right here. And this is the. So let me go a bit more inferiorly here now. And coming more inferiorly, you start to see the cochlea. You start to see the facial nerve, the tympanic part of the facial nerve here. Did we see here? Okay. Here, this groove here, right here, that we may have missed, is the groove for the GSP and the greater superficial petrosal nerve. And let me go down a bit more inferiorly, the facial nerve, which is just above the lateral semicircular canal, and is going to cross over and go into the mastoid. At the same time, let's look at what is happening to the cochlea right here. Let me go right down. And here you can have a beautiful view of the cochlear foramen right here. You can see the modulus, and you can see the posterior lamina right here. And what do we see here? We see here is what is called the processus cochleaformis right here, which is at the anterior end of the oval window. Is the processus cochleaformis, and it is around this cochlear processus that the tensor tympanic tendon will wrap around. And at the same time, what has happened to the facial nerve, it has crossed over into the mastoid, and this is what you see here is part of the piece right here. So let me, and here, before I forget, you see this canal here? It is going to the vestibule. It is going to the posterior end of the ampullary end of the. Okay, and let me show you what it is. This is the singular foramen, right here, and you will be able to see it on all three cuts here. Here you can see it very nicely, but on the sagittal cut here, it appears like a small little round hole. But this is the singular nerve, and above that was the if you want. So now let me go down more inferiorly. Now here you see that. See how the tensor tympani is going on to the manubrium, and you can see beautifully the anterior limb and the posterior limb crura of the stapes, and that's the lentiform process here. This is the facial nerve, and here you see the ampullary end of the posterior semicircular canal, and you can bring your pocket here, and you can actually see that this is the ampullary end of the posterior semicircular canal right here. All right, see that is again a spoon configuration. The posterior semicircular canal has the spoon configuration twice earlier on later. So here we see the processus cochleaformis. Now, if you look very carefully, not the processus, I mean the stapedial or the pyramidal eminence. If you look very carefully, you can see a nerve going right from the facial nerve into this pyramidal eminence. And I think maybe Satish can correct me later. I think that's the nerve to the stapedius muscle. Not certain about it. I tried looking up the literature, nothing there, but it very likely seems to be so. And here at the same time, you can see the facial recess and the sinus tympani. This is the facial recess right here. This is sinus tympani, and this is the basal turn of the cochlea. Let me just go down more inferiorly. Coming down more inferiorly right here. This is forming the promontory. Now you start to see an air bubble here. The moment you see an air bubble, there should be something happening from the air bubble. To me, it looks like a, I don't want to say it, but it looks like a sperm. Okay, so you see the head of the here, right here, and you see the air kind of here, and that is below the internal cortical meter. So what is that? That is the cochlear aqueduct, and you can see how it opens up here into the subarachnoid space. And go back up here, there goes there, there's a cochlear aqueduct. So let me go more inferior now right here, and here you can just tell the tympanic membrane right here. This is the tympanic membrane, this is the promontory. Let me go more inferiorly here. Sometimes you can see the tympanic branch. Now this is the right here is the pars nervosa. So let me see if you can see the not every time, but sometimes you can see that. Here you can see this little canaliculus there. That is the inferior tympanic canaliculus right here. You should be able to see it right here. Beautifully, you can see it going from here. See, this is the pars nervosa. You can see a little canal going here into the middle ear and coming onto the promontory. Right here, this canal, and this is here. You can't see it very well there, but you can see. So what I love about this software is that you can basically, it's like playing a game. You have so many cards, you can scroll up and down, and this really revolutionizes your knowledge of anatomy. And you can't be dissecting all the time, you can't be doing that, but you can learn a lot of anatomy just by looking at the CT scans, just by. So this has been a really a learning curve for me, and I must thank Satish to introduce me to this Radiant software, and I use it every day of my life, and I love it. So let me just go down a little bit more. Okay, so we are coming more inferiorly now. More inferiorly, and let's see what's happening here. Okay, go back here. What do you think this is? This was the internal acoustic meters. Let me go down now. This is the jugular foramen. There you go. All right. And this is the carotid canal. Now, this is what I want to show you. Satish was talking about a small vertical segment, and then it becomes. Let me show you. You can trace the entire carotid, internal carotid artery. See that? How it enters here. This is a more better, I think, rather than that cut. You can see here entering this is a small vertical segment. Note how closely it's related to the cochlea. And then it becomes the petrous, the horizontal part. This is the horizontal part, and then the vertical part. Okay. So you can trace the entire course of the carotid artery just by moving your mouse up and down. I think this is the way basically to study radiological anatomy. So coming back here, let's see, this is the facial nerve. And let me go a bit more inferiorly right here. And the time it widens, that means you are at the end of it. That is the stylomastoid foramen. And what is this right here? That is the hypoglossal canal. So you can see right here, see that? It runs from, you can see here, running across, transversely across. This is the hypoglossal canal. And you can see here, right here. Okay. Other interesting is, what is this foramen right here? This one right here. That's the condylar canal. So let me see here. That's condylar canal, and you can see here coming down and opening right here. That's the condylar canal, and how we can confirm it right here. This is the condylar canal. Okay, so I have a lot to talk, but how are you doing for time, Satish? Hello.
Hello.
Hello, Satish. How are you doing for time?
So, how much time is means you want to take, sir?
I have just 5 minutes more.
Okay, carry on, carry on,
Can?
carry on.
Okay,
Yes, yes.
so I just want to talk a little bit